on mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxxer, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxxer, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry of Health.
A very good morning to you who is still watching UBC TV. Thank you so much for keeping it with us. I'm sure, Chirabo, you have been with Chirabo throughout the hour from 9 to 10 on GMU Extra. Now you're here with me, Sophia Matovu, who is going to take you through this special edition of a talk show. I believe last week on 1st July, you did join in and you were part of the conversation on donor fertility programs. Now this time we still opted on matters to do with the pathway after having seen what came out in the new vision on Friday. Infertility in men is, just raising higher. Well, let's use this opportunity to still address some of the issues with you. Now, male infertility is a global health concern, affecting millions of couples, with male factors contributing roughly to 50% of infertility cases. That is quite a huge percentage, 50% of infertility cases. The prevalence of male infertility has been increasing. I would like to say that again. The prevalence of male infertility has been increasing, with a substantial rise in cases since 1990. That is according to a study which was published in BMC Public Health. Those are not my words, and it's a fact that is out there. Now, I'm not the expert like I normally tell you when it comes to these matters of health, but I always make an effort to get you the best. Now, our topic today is casting light on male fertility issues. In the fertility issues is infertility and any others that are male-related. The experts in studio are Dr. Moses Batwala, the medical director and founder of Fiona Fertility, who is based in Dubai. Dr. Moses, good morning. Okay. Thank you for making time to be part of the show, because we do really appreciate. We know you're very, very busy, but the mere fact that you can spare time to come through is quite amazing. And then with me in studio here on set is Dr. Judith Aikiriza, who is a gynecologist and a fertility specialist. How are you, doctor?
I'm okay, Sophie. Thank you for this show.
Okay, thank you too for making time to come through. Now let's start with infertility. When we talk about infertility, and specifically in men, what do we mean?
Thank you very much, Madam Sophie. I'm privileged to be here for this show once again. When we talk about fertility, infertility generally, we refer it to the couple. Like 2 people, a male and a female, having frequent sexual intercourse but have failed to achieve a pregnancy within a period of 1 year. That is for couples, a female more than 35 years. Then that is for couples, for females less than 35 years. But for those above 35 years, if they have actively tried to conceive within a period of 6 months and they have not achieved a pregnancy, we still say that is infertility. So our topic today, we are mainly focusing on the male infertility. Male infertility is inability of the male partner to make the female partner pregnant within that specified period I've talked about.
Okay. Now I come to you, Dr. Moses, because the New Vision, like I said, published an article, or they had their headline on Friday, which said infertility up in men. I would like you to speak to it, because even if the facts are showing like 50% of the men contribute to that factor, please, I would like you to talk about it.
Thank you, Sophia. There are many theories as to why male infertility is rising. And we do have the records to show this is not a hypothesis, it is actually a fact. When the World Health Organization has been keeping records and looking at the averages, the average sperm count has been reducing gradually since the 1960s. And this has led to an increase in the contribution of male infertility towards the general infertility landscape. And as I said, no one is 100% sure exactly why this is the case. And there are many hypotheses, which I'll speak about now. The first hypothesis was that in the 1960s was when the female contraceptive pill became more common. And when women started taking the contraceptive pill, they're taking it has a high estrogen content, and it's excreted through the women's kidneys. And this is when they pass urine, it goes into drainage and eventually into the water supply. There was a hypothesis that this is increased estrogen in the water that men are drinking nowadays has contributed. This is not a proven fact, but it's one of the hypotheses. The other hypothesis is on microplastics, and I know many people have spoken about and the different things it contributes to. It contributes to maybe more dementia or Alzheimer's in the population and other health like irritable bowel syndrome. But also one of the other hypotheses is that these microplastics in the food we eat, the water we drink, has contributed to male sperm count and male fertility decreasing. Again, this is not anything proven. We don't have a concrete reason as to why it is happening, but we do know that it is happening.
Mm-hmm. Now, to both you and Dr. Judith, you're going to speak to this. Now, should we say that, is it true, does lifestyle also contribute to this effect? Because for the women, we have seen through the delay to have children, and the same is possibly happening for the young gentlemen out there. Could that be one of the causes of infertility?
I would say lifestyle, yes, and they are definitely things in a man's lifestyle that can contribute to a poorer sperm quality. The biggest one is smoking. Smoking really harms the quality of the sperm, even passive smoking. So even if you're not a smoker per se, but you live in an environment where you're surrounded by smokers and you're passively breathing in cigarette smoke, this gets absorbed through your lungs into your bloodstream and releases free radicals in your bloodstream. Free radicals are quite harmful to the DNA of sperm as it's developing. So definitely smoking or living in a environment where you're exposed to smoke can contribute negatively to the quality of your sperm. Mm-hmm. The other thing is obesity, being overweight. And why this is really important is one of the reasons why men have a scrotum is because the testicles require a cooler environment in order to function properly. But with men who are obese, especially, they have really large thighs which press hard on the testy, and that increases the temperature around the scrotum, decreases the quality of the sperm. Putting on underwear. Human beings, we were not designed to actually be fully clothed with tight underwear. But again, tight underwear increases the temperature of the testes, of the scrotum, and this also contributes to a decrease in the sperm quality.
Mm-hmm. Okay, then getting to you, Dr. Judith, could we say there are also sperm transport issues? You'd say, do they contribute to that?
Yes, the sperm transport issues do impact on the semen quality, the sperm quality, in that basically when the sperms are produced, they're produced in the testes. Now, they have to move through certain pathways. through their openings, small openings in the male system, and they have to join the urethra where they have to be ejaculated into the female. So if there is any blockage along those ducts, it will affect the movement of the sperms, even though someone has these sperms in. So they really do.
Talking about the blockage, what could be the causes of the blockage? We thought blockage is majorly more in the women when it comes to the fallopian tubes, but now you're talking about blockage as well in the pathway of the sperms.
Blockage it is majorly caused by infections. Infections like sexually transmitted diseases, such as gonorrhea, chlamydia. Someone may not have any symptom of these, but they may be silently there and they cause scarring in these passages, which will eventually prevent the sperms from coming from the testis to the urethra, and then they can be ejaculated to obtain a normal semen analysis and then eventually giving a pregnancy. But other things which can cause blockage could be maybe a tumor in the pathway where the sperms are supposed to pass. It could be any trauma, maybe someone had an injury which they have even forgotten about, and it has caused a damage to any of those tubes. Then, most remarkably in Africa, there has been an infection in childhood called mumps. If a male child got mumps, by the time they've grown up to be adults, they have totally forgotten. Some childhood infections like mumps can cause a lot of inflammation, which heals with scarring in the testis or in the ducts, and then it can impact negatively on the sperms.
Okay.
Yes.
Dr. Moses, I get to you because based on some of what Dr. Judith is saying, it's worrying if these are silent symptoms that might not be able to be detected a lot earlier, like the scarring. If it doesn't, I don't feel any pain, and yet I have internal scars affecting it, then how will they know? You might want to speak to some of the symptoms when it comes to how men can easily identify and know that there is a challenge.
Yeah, and yes, and as Dr. Judith has said, something which is quite significant is mumps. And mumps, most times that people are affected by mumps is when they're a child, and they could be under 6 years old. So it's very difficult to say, oh, what symptoms did you have? But it's especially if you haven't been immunized, and it's really important, especially and this is a message going to the mothers out there, make sure your children have the MMR vaccine, measles, mumps, rubella. Okay, rubella will protect your daughters later on in their reproductive life. If they become pregnant, prevents them getting German measles that can negatively affect any children as they develop. But also for the boys, if they develop mumps when they're young and they get so when they're young, they'll get mumps, but mumps which will normally cause swellings on the neck glands, which is the most dominant symptom. However, they may sometimes get inflammation of the testes, and as a child they may rub the testes, but this is not something that they would remember years and years later. And yet we see this when some men present, and sometimes when you do their semen analysis, either the sperm count is extremely low or it's completely absent. Okay, so it's not something which they would easily, because most of the time these infections occur to them when they're really young, under the age of 10. I'd say for 99%, 90% of the people are affected by this.
Oh, wow. Now, there's certain times when you talk about infections, it's more of a term people would classify and say it's common among the children every time they're taken for diagnosis, infection, and categorically among the females. Now, how do you help the men? Because they also do sometimes get some of those, but might take them minor or slight, because traditionally a man is supposed to be a man. You're not supposed to fall sick.
And that is the issue, that most of the time these are not severe infections. These are not in the women who get chlamydia or gonorrhea. Sometimes they're completely asymptomatic and they don't have any symptoms whatsoever. It's only when maybe they get a test done that shows, oh, by the way, you had been exposed to chlamydia when you were younger or some time back. sometimes it is a severe, sometimes it can be a severe infection, whereby with the men they may get actually pain when they're passing urine, pain on intercourse, even pass through the urethra,
Okay.
through the urethra. But a lot of the time it is asymptomatic. But if you do get these symptoms where you're getting pain on the scrotum or pain on intercourse, do see a do seek medical advice. Do come in, see a doctor, see your GP, go to the STD clinic and get screened. But also more importantly, if you do have sexual partners and you're diagnosed with this, inform them. Because once you inform them, they too can go and get checked and get the urgent treatment that is required, which would prevent this becoming more severe.
Now, let me first get to Dr. Judith. Dr. Judith, we normally have this tendency of men shying away from talking about some of those issues. It's a women's issue. You have a couple that's been living for years, and the lady cannot conceive, yeah? But the man is in denial and cannot believe possibly he's got to contribute to the childbirth, and it's always the woman who fingers are being pointed at. It is you, it is you. What is your take on that matter?
Honestly, in Africa, we must acknowledge that when the couple is failing to give birth, the blame is usually put on the female. It takes a man maybe leaving this marriage and getting to another one, and maybe things are failing, that they start maybe to think about themselves, that I may be having an issue. So in this case, it would be better if a couple is struggling to conceive, it would be better as a couple to be seen together. We shouldn't have a blame mentality of thinking that fertility issues are basically for women. They impact both males and females. Just like from the statistics we've seen, 50% of the cases of infertility, males are involved, male factors are involved. So I think it's high time the men dropped the mentality and they developed the positive mindset that it's not only women who contribute to fertility, but they equally do. And I encourage men out there not to feel shy. If you feel you've taken 6 months and your wife is getting more than 35 years, it would be better even to save time to come in always as a couple and you be screened. Because sometimes you find it is time saving for the man to come even on the first consultation. When you do a semen analysis and it depicts significant abnormalities like no sperm count, severe reduction in the sperm count, it saves time and even money. Instead of trying many options which wouldn't work, would be more specific to the treatments. Yes.
Okay. Now, Dr. Moses, to you, because speaking from what Dr. Judith has said, talking about issues like no sperm count, what does that mean? And really, when it just indicates no sperm count, is there any hope for a man of that nature?
Okay. And I'd really like to just reiterate what Dr. Judith said, that one, it's not a blame game. It's not, oh, it's this one to that. This is treating a couple who want to have a child. And the truth is, there's a lot of help out there. There are many things that can be done. So people shouldn't feel shy and think, oh my God, this is a disaster. There is a lot of help. And actually, believe it or not, when male fertility is a problem, it is actually a much easier thing to solve, much, much easier than when there is an underlying female problem. And so that's why I'd say I really encourage them to come forward and get investigated. Secondly, and you've spoken about the New Vision article, which talked about male fertility. There was another previous New Vision article that spoke about men's mental health. And the reason why I mention this is literally male identity is very closely linked to their virility, how capable you are to have children. And when a man gets told that there is a problem with their sperm count, they feel it is a big it has a big effect on their identity and who they are, and it can lead to depression. But again, with one of the things Fiona Fertility does is not only do we address the clinical, but we also address the clinical, the psychological side of things, and we do offer counseling because it is important. Men are not as good as women who share and talk about what they're going through, including things like fertility. We do encourage it, but that's just not in men's natural nature. It is getting better. More men are talking about mental health to their friends. There are lots of support groups that are starting up, but we do notice that this is a problem, and we really do encourage men to come to us. There is help. We do offer counseling, and also if you have a good friend, speak to them. They may have gone through something similar, and you will find support out there.
Men prefer keeping quiet about some of those issues. Is it just the way they are naturally, where they say you die in your own movie, but you'd rather not speak about it? Sometimes by the time they get to discover it, it is too late. Sometimes some of them will get even to challenges of when they get to a DNA, and then they'll get to discover that the child is not theirs, without knowing that they literally, or maybe all the children are not theirs, without them having not realized that they possibly have an issue. How do you help them sail this journey?
I'd say it is a big problem, and it's not that men are naturally like that, but these are the pressures of society about what the male person should act like, what they should be like, and maybe it is a huge pressure on them that they feel they have to fit into a certain stereotype, which I feel is slightly unfair on men, and a bit it's a big pair of shoes to fill. And all I can really encourage men is there is help out there. Don't feel don't think you're alone. It's actually roughly 10% of all men. That's like if you know 10 men, one of them has a problem with their sperm count, which is a massive statistic. If you see 100 men, 10 of them are affected. And so it's almost impossible that one man will not know another man who has a problem with fertility, who has a problem with a low sperm count. So it is affecting your friend, your brother, your father, your cousin. If you feel that you're going through a lot of things, first of all, come to professionals who can give you professional help. But then also talk to your partner, tell them what you're going through. And then maybe if you have a friend who you trust, speak to them as well. There is a help out there. Even in our churches, in our mosques, the pastors, the reverends, the imams, they do know that these things, and they can give you pastoral guidance when going through these problems.
Now, you talked about the tight-fitting underwears and all that having an effect on it. That's the heat-induced, Do also things like, we're talking about trends now. These are things that routinely men do. Go to the saunas, go for steam baths. Do these reduce the sperm production, or do they have a quality on the nature of sperm?
What I'd say is, if you have an already compromised sperm count, going to places like saunas will actually affect it even more. It will cause a further decrease in the sperm quality. So that's saunas, jacuzzis, anything with having long baths as well. I'm who likes having a long to dip myself in a bath over the weekend and just spend like an hour or so. But if it's a hot bath, that is going to raise the temperature of the scrotum, and that will negatively affect count as well. So those are lifestyle things that we do advise men to actually decrease or stop completely. Men who spend a lot of time at a desk, if you have sitting at your desk for long hours, with your knees close together, or even having a laptop on your lap for long, that's all increasing the temperature around the scrotum. This kind of raising a temperature does then affect the quality of the sperm.
Okay, now I get to you, Dr. Judith. How is diagnosis for this kind of situations done? Because there are certain times people still feel a little bit uncomfortable. They'll come and open up to you about the condition. But now the whole process of the diagnosis and how it is done possibly can help allay their fears, or if not so, can even increase what they already assume and think is supposed to be done in terms of fear.
Thank you very much. About the diagnosis for male infertility, basically we begin with taking the history or understanding more about this patient, how long they have tried. Then we take some bit of history from their childhood, possible illnesses which they got. Then maybe to the mothers would want to be sure that if a mother produces this child, it should be a routine to check if the boards are actually in the scrotum. We may need to know if the boards are in the scrotum from the history, if a patient is able to tell us, but I don't feel anything in my scrotum, it would be important. Then the childhood illnesses, the sexually transmitted infections. Then when we've gathered all that history, of course we do the examination to check whether the boards are there, whether the genital organs are normal, because some physical abnormalities can be seen physically and you can anticipate what find even in the other examinations. Yes, so like if there are no boards felt in the scrotum, usually you may not find sperms when we proceed to the semen analysis, which is the first investigation to do. So semen analysis is the first investigation we do, where we require a man to have abstained for at least 3 days. Then they are good to go. Usually they may have a sample got maybe by doing the intercourse with their wife and then withdraw sample, or masturbation. And then they're able to obtain the sample and it can be analyzed. The test usually takes about an hour to get the results. It talks about the volume of the semen collected. It talks about the quantity of the sperms. It talks about how fast the sperms move. It talks about how many are alive and how many are dead, because all those parameters affect and they even guide the management. Then when the semen analysis is done, if it's normal, usually we may not need a further evaluation. That's why Dr. Moses said male issues are easier even to handle. Assume the couple has come on the first consultation and we've done a semen analysis and it's normal. For the man, most times they are fully investigated. Now we shall concentrate on the woman. So if we have abnormalities in the semen analysis, that's why we shall proceed with other investigations. Other investigations will be scanning the testes to see if everything is normal, the ducts which take the sperms, if they are all normal. Yeah, the scan will basically pick out the size of the testes, whether it's in the normal range, whether it is reduced, whether it is increased, all those will be picked up. If there is any swelling that is interfering with the sperm production, all that the scan will take it up. It's not the normal abdominal scan. It is called a testicular scan. So it is specifically scanning the testes. Then we have other tests that we do, like genetic screening, where we look out for the Y chromosome of the man. Sometimes it may be overly long or having some elements missing to make it the normal Y chromosome of a man. Then we look out for other genetic conditions like cystic fibrosis, which that one also causes obstruction in the ducts we had talked about. So we do genetic tests, then we also do hormonal tests. Hormones, we look at the whole pathway. We know when sperms are being formed, it's not only the testes, the whole body is involved, right from the brain. So we look at the hormones which are produced by the brain, particularly the pituitary gland. We look at those hormones. If they are normal, we also look at the ones which the testis itself forms under the regulation of the hormones from the brain. We all compare the two, the ones produced by the testis and the ones produced by the brain. Then we can be able to understand if this reduced sperm count or zero sperm count is from the causes resulting from the testis or the brain. We can be able to figure out what is the possible cause by doing a semen analysis, then the hormonal profile and the genetic tests plus the scrotal scan.
Okay. Dr. Moses, I'd like to ask you, picking up from Dr. Judith, talk about genetics here, because it seems, should we say that these are some of the things that it's, you know, a family trail or hereditary rather, now combine it with the genetics. How do the two correlate?
Dr. Judith has very rightly pointed out the investigations that we do. Now, on the genetic trail, it's very interesting. One of the things that we notice is that when we do fertility treatment for men with a low sperm count, if they have sons, those sons also have an increased risk of also having a low sperm count. So there is a genetic tendency in this. We don't know exactly how it is transmitted, but we know it exists. And actually, if you think about survival of the fittest in nature, most of these men would not have had children, and therefore this gene would have been selected out of our populations. I'm not advocating for this, but this is an interesting trend that we notice, that men with low sperm count, if they have sons, will have sons with also a low sperm count. And it is the geneticists who have pointed this out to us. Most of the genetic abnormalities that we see that cause severe low sperm or absent sperm, they are normally spontaneous. It's not like they were inherited. It's something that appears in just one person due to what we call a new mutation.